Hey everyone, welcome back to another episode of the Deals for Dentists podcast. I'm your host, Dr. Eric Block, and through these podcast episodes, I'll be interviewing dental professionals and companies and aim to inspire, entertain, and educate you on the best tools and technologies out there. My goal is to help make your practicing career more profitable, efficient, and most importantly, more enjoyable. And also be sure to check out my latest book, Stress-Free Dental Implants, Re-Energize Your Career with Implants, and my first book, The Stress-Free Dentist, Overcome Burnout and Start Loving Dentistry Again. And today we are joined by Dr. Dar Radfar. Thanks so much for joining us.
Thanks, Eric, for having me. I'm excited.
And where are you zooming in from today?
I'm in Thousand Oaks, California today. My practices are here in Ventura County, California, and I live in Calabasas, California. But I also have a place in Miami now for the last year or so, where my business outside of a dental practice, but within still the scope of dentistry, called Rad Health, is based out of Florida.
Okay. And you seem like you're very passionate about sleep apnea and insomnia. So let's actually start with that. How did you get involved with sleep apnea?
Yeah, I'm actually I live and breathe sleep. And when I was 6 years old, I'll tell you a crazy story. My family and I escaped from the country of Iran to escape religious persecution, and horseback riding into the mountains of Turkey with coyotes that were from Kurdistan helping us. One of the things I was told at 6 years old as I was on the horse through the treacherous mountains is, don't fall asleep. Don't fall asleep. That was resonating in my ear the night that we escaped. Because if I did, I would have fallen off the horse and down a cliff and never would have survived. And then fast forward in 2009, at the age of 32 years old, I actually fell asleep at the wheel one night when I was driving home a block away from my tree. And I walked out of my car, came out, looked at the front of the car. It was completely wrapped around the tree. Thought I touched my arm, my face, no blood, nothing broken. I went back to the driver's side to see if my body was still in there. I thought maybe I was having an out-of-body experience, and I guess there was life after death, but luckily there was nothing in the car. I was okay. And that propelled me to, with daytime sleepiness as one of the indication, to get a home sleep test, and got a CPAP machine, couldn't tolerate it. And in 2010, when the oral appliance was kind of put on the market, and Dr. Gian Stanford and all the professionals in the American Medical Association approved the oral appliance and Medicare approved it, I was one of the first ones to make one for myself. And that's how I've been able to help thousands of patients since then. I've had some personal experience through it. And so it's been a blessing to help people and see their lives change through the simplicity of an oral appliance.
So you fell asleep at the wheel. Do you remember the crash?
I do remember the night. Yeah, I remember falling where I was almost home, and then the awakening was just the impact and the airbags deployed in my face. So it was. I don't remember feeling the actual impact into the tree because I was asleep. And so it was when I woke up, I just saw the whole smoke and from the airbags, I guess. My first and only accident in my life, and I'm 45 years old. So,
and you were essentially uninjured?
Completely. I had a little bit of when I touched my nose, just a little soreness, but no one would really believe me that I was driving the car. I mean, it's to this day, I don't get it. It's really weird. And the scary part, Eric, is we've all had this tiredness throughout the day. I mean, I'm sure your listeners have had it where we were falling asleep, possibly when we're driving, or even the functionality at work when we're seeing patients, or if we're not a dentist, or any sort of focus and ability to have enough energy at work, or to be a little bit more in a happier mood. These all are tales of possibly not sleeping well. And it could be even insomnia, because we've got so many things going on in our minds. So I've actually been able to gear towards the insomnia part and the anxiety part as well, kind of pivot towards that and help patients with that as well with my supplements.
And you mentioned that you tried a CPAP, was it just you couldn't tolerate it? Is it not comfortable? You couldn't sleep with it?
Yeah, I'm a stomach sleeper usually inside. So when I was turning around, it would fall off my face, and no matter how tight I had it against my face, it seemed to, have a leak. And so then you feel the air coming, and it would just wake me up every 30 minutes to 45 minutes. And I tried for a couple of weeks, it just wouldn't work. That's what I've seen. I think they estimated at the American Sleep and Breathing Academy, we've seen the estimation of compliance be around 30% for CPAP machines. That means 7 out of 10 people have had a sleep study. They know they have medical comorbidities or conditions or sociological things like snoring and whatnot next to a bed partner that are disrupting their lives. And yet still 7 out of 10 have no choice. And we are, I guess, next, even though most people now believe oral appliance therapy, especially after the recall that they had for CPAP machines, 3.5 million Philips machines were recalled last year, that oral appliance could be the actual standard of care due to compliance being much higher than CPAP. And so, it behooves us dentists, if we're not trained in it, and at least to be able to just understand it, see it in people's mouths, the characteristics of what apnea looks like with the size of the tongue, scalloping of the tongue, and the lower anterior wear or dry mouth issues or the medical comorbidities associated with it. And at a minimum, let the patient know what you see and trained in how to refer for a home sleep test, or you can't in your state, depending on the laws that are out there.
Yeah, and the CPAPs, you're right about that recall issue. That was such a mess. I had some patients that had to send their machine back, and they're waiting for a year or two. You have to keep those clean, and
Yep.
there's maintenance involved. Also, if patients get up to go to the bathroom, they probably take it off, and then they go to the bathroom, come back, and they don't put it back on. So compliance is a major issue with CPAP. Did you say you created your own appliance?
Yeah, no, I actually I made an appliance back in 2010, a sleep herpst appliance. It's not my own appliance. It's one that's pretty standard out there that, it's been Medicare approved and approved by the FDA. It's one of the most durable appliances. I've used that pretty exclusively over the years for my patients, called the sleep herpst appliance. I've developed my own sleep supplement to help with anxiety, insomnia, and actually also to help open up your airway. Ingredients in the sleep supplement have actually shown to reduce sleep apnea and snoring through NIH.gov studies with the ingredient called N-acetylcysteine, or the amino acid cysteine, which I've placed into the supplement that I've created.
How did you discover this, the amino acid cysteine? How was that discovered?
So I'm a biochemist at heart. That's my major. My dad's a chemist, or was a chemist back in our country. And so I've always been good at chemistry and putting things together. And just through research, we've got the technology now that you can read clinical data from different ingredients like L-theanine, and what it does, and tryptophan and valerian root, and even small amounts of melatonin, how much is safe, how much is not. And then so when I looked up supplements for sleep apnea, there's a bunch of articles that came out with already clinical studies. See pretty much at the top, the NIH.gov study that was done in 2011 with sleep studies showing Epworth questionnaires going down, meaning people feeling less tired, more energized, let alone actual sleep tests showing the AHI's apnea hypopnea index. That's the indication for sleep, and the severity of it going down, along with snoring sound and snoring length of time that you snore. So it acts as a expectorant of the mucus in your lungs and your airway, and it also helps as an antioxidant for the lungs. It's been used and recommended for the treatment of COVID to take NAC when you have COVID to prevent breathing issues. So it's very good for breathing itself, let alone an antioxidant for your liver. It uses for acetaminophen poisoning and liver toxicity. So it's got a lot of good benefits, and especially now in sleep when it's combined with, I call it the Fab Five ingredients. When you combine NAC with L-theanine and tryptophan, valerian root, and a small amount of melatonin, you get a very good synergistic effect of helping you fall asleep, stay asleep, and breathe better.
Yeah, so I mean that's a major issue, is even just getting to sleep. Mandibular advancement devices are great to open up the airway, but someone that needs help to get to sleep is a major problem. So that's it sounds like you have a full system here to help a patient get to sleep and then stay asleep, and then also increase their airway. Is that kind of the goal of your program?
Yeah, it's because, when we came back in May to see patients in 2020 in California, a lot of my patients that come in for me to just see how their appliances are going and tightening up the screws and making sure there's no cracks and whatnot, or doing an advancement. I ask them, how are you sleeping? And they're like, this is working, because when I'm actually falling asleep, I'm not snoring, or I feel, my bed partner is not telling me that I'm gasping for air. I feel fine, but I got to take a Benadryl before I sleep. I got to take Advil PM and Tylenol PM, or I'm taking half a Xanax or Ambien or Lunesta. And I'm asking them, I go, do you do this every night? They go, yeah, I got to. Or I smoke a little weed in California here. So, and I'm just going, wow, this is liver toxic. It's kidney toxic. If it's, Advil PM, and you're doing this every night, it also can possibly make your apnea worse, because you're taking a real hardcore sedative like Xanax or Valium. And so I was having problems myself. I don't know, Eric, did you have thoughts in your head when COVID happened and you're going back into the office and seeing patients? Like, we all went through it. Some of us were brave and said this is our job, and some of us, including some hygienists and staff, were just like, I'm not going back to work, I'm retiring now, right? And so kids on Zoom, all these things that we're dealing with, and we still kind of deal with it, creates that anxiety. And we don't want to be taking prescription drugs, or even just because it's over the counter doesn't mean it's not toxic to your liver if you're using it every night for a few years. And so that's why I want to try to formulate an all natural route to help patients wean off of the drugs, so to speak, and go all natural with the Rad Z's that I created.
And what is the connection between sleep apnea and TMJ dysfunction?
Yeah, so that's another thing, is the anxiety and whatnot causes us to kind of get a little bit more, do some what we call bruxism, which is grinding our teeth. But sleep apnea itself can cause grinding of teeth, because when you're not getting enough oxygen, your body goes through a fight or flight response and gets anxious, and we tend to clamp down our teeth and kind of grind forward, creating, in a sense, our own mandibular advancement if we're not wearing a CPAP or oral appliance. And so a lot of people say, well, I sleep with my mouth open, how am I grinding my teeth? Well, that's an indication you have sleep apnea and you're doing that grinding forward pattern. Most of patients who have TMJ issues and show bruxism, wear and tear, show more wear and tear on the lower anteriors, as opposed to grinding left and right. They're grinding state. So they're very much correlated. And as a dentist, we tend to make them a night guard, right? An occlusal splint, perhaps make sure that the splint has a flat plane, so at least they can still grind forward and not cause them to stop with an anterior kind of stop there. So if they're not interested in checking out their sleep through a sleep test, and maybe ultimately getting an oral appliance or a CPAP, then at a minimum we make them to protect their teeth, a hard splint that allows them to still grind forward and not prevent them from doing that when they go through an apneic event.
And now, is this part of your every patient questionnaire when they come in as either a new patient or recall, is asking questions about their sleep history?
Yeah, there's problems, concerns, any sensitivities, and then it's how well do you sleep at night? And they could tell you I sleep great, and they're sitting in their chair well, excuse me for saying this, they're overweight or obese, and you can almost hear them struggling while they're awake. They're almost like, doing like a snoring sound, and they're not going to always be truthful. You see their tongue in their mouth, it's ginormous. You barely can see the airway. They're Malampati 3 or 4, tonsils are huge, lower anterior wear, dry mouth, tartar all in the front there. And you still have to, I think, open your eyes and open your mouth and your heart, Eric. It's so important to just say, hey, this is what I see when I have you laying back. I see the tongue kind of collapse back. If you ever have been told, or will be in the future, you're told that your bed partner says you stop breathing, or you snore too much, or you're tired throughout the day, I can help you. And then just, I move on. If they're still not into it, they'll usually come back 6 months later and be like, hey doc, remember when you were telling me about that? My wife's telling me, or my husband's telling me that I'm snoring a lot more now. What can we do about that? They may not tell you right then and there. And then, of course, the other question is do you have any jaw discomfort, any popping, clicking of your jaw? Those are standard questions. Asking about sleep NTMJ at every recare or recall appointment and for every new patient.
And I love how you mentioned, this is what I see, and I can help you. And asking them if they feel refreshed, or if their bed partner is elbowing them because they're snoring. And also your story, how you yourself fell asleep at the wheel. That brings a lot of power to the conversation too. And maybe treat a team member. Yep. And take care, or team member's family, and all these things. You can really start to develop a sleep practice within your practice. Or do you see general dentistry patients as well, or do you focus?
Yeah. That's 75% of my day is I do 30 to 40 crowns a month, and I place implants, and I actually do traditional braces, which helps in the pediatric world. If we kind of shift a little gears, even for kids who have snoring issues, expansion of the jaw, correcting class 2 mandibles. The reason for my recommendation of phase 1 orthodontics, whether you do it yourself or refer it to an orthodontist, is to help lower the risk of sleep apnea. Oh, and by the way, we want to get a little bit more room for the teeth to come in and help with the profile and the bite when we're treating 3 millimeters or more class 2. It's not just the snoring and sleep apnea that we could prevent for your child through orthodontic care at a young age, between the ages of, let's say, 7 or 8 till 12, 13, if we can catch them that early to do this kind of expansion or appliance type of therapy. So definitely I do. The ortho was kind of a push in 2010 because I saw the need to help patients not only make their smile better, but more importantly, to get their space for their tongue by doing expansion and more airway room for class 2 correction.
Now, what do you recommend for someone that's, a dentist that's trying to get involved with sleep apnea? You're a diplomat of the American Sleep and Breathing Academy. Is that a good place to start, or is it, just getting educated? What do you recommend there?
Yeah, there's tons of courses that you can take. I would say at least take 1 or 2 courses. Learning the appliance and how to adjust it and all that is super easy. We do so much more harder work in dentistry. It's more the knowledge of what to look for in the mouth, the medical comorbidities that are associated with this, such as high blood pressure, diabetes type 2. When I look at a medical history and I see check marked, whether it's an existing patient or updating the medical history, or a new patient, when I see high blood pressure, we know that 30% of patients that have high blood pressure, it's associated with sleep apnea. Fix their sleep, 3 out of 10 patients can be weaned off their medications because now they're breathing better and they get vasodilation and not constriction of their arteries. Acid reflux, 60% of our patients that have reflux is associated with sleep apnea. To learn these things through a course and the reasons behind it, diabetes type 2, insulin resistance, stroke, heart attack, 5 times higher risk of cancer of any kind. I mean, when I look at a medical history, if I see any of those indications or medical comorbidities, right away, I'm even more adamant of how well do you sleep at night, because we look in the mouth every 3, 4, 6 months, right? And we're able to at least guide them to a sleep physician in our area. You know, even if the numbers that I've seen in my office, I opened my mouth 10 times to a patient, to 10 different patients that I think may have apnea based on what I see in their medical comorbidities and what I see in the mouth. 3 will actually get a sleep study. 1 will get treated. Now that to me is incredibly, amazingly high, good numbers. I know it sounds low, but if I can help 1 out of 10 patient actually get treated, not have a heart attack earlier in life, live 10.3 years more on their life, because that's the average life expectancy that's lost if you're untreated for sleep apnea, is 10.3 years. Not fall asleep at the wheel. Eric, what would happen if you fall asleep at the wheel? I mean, like, and at 4% of crashes are people falling asleep at the wheel. It behooves us to talk to the UPS in our area, people who are driving trucks, or the MTA, or the bus drivers, you know, Amazon drivers, you know, doing some sort of campaigning to get those people safe, you know, and driving these cars. So we have kids, we have families. You know, what happens if someone hits us, right? And if we can help one person prevent all those things, we've done a lot in this community. And that patient will be a patient for life, because you've not only changed their medical well-being, but more importantly for them, their ability to possibly sleep next to their bed partner, which is a big deal.
Now, what's your workflow or your protocol with medical insurance or the home sleep study? How do you usually handle that?
So the home sleep study, I refer to the sleep apnea team here in Torrance, California. Basically, we just send over the medical insurance information and the RX form from me to them. I would tell you, for medical insurance, they do my medical billing as well. One of the things that we dentists are like excited about is, let's do medical billing. There's thousands of dollars that are being paid. You know, if you're charging for an appliance around $2,000, how much do you place implants? Obviously, right? You wrote a book on it, great book. Mm-hmm. So how much do you charge for, let's say, extraction, bone graft, implant, abutment, and crown? What's the average dentist charge?
I would say if you add all those things in, you're probably around $5,000.
Right. So it's $5,000 to replace one tooth. And in our world of dentistry, it's very important to do that. We both place implants, and we want to prevent shifting and more chewing on one side compared to the other, all that. For a couple $1,000s, you've had a patient that's gone through some sort of home sleep test or lab test that they know they have a medical condition. Possibly they're embarrassed sleeping next to somebody. There's medical comorbidities and tiredness throughout the day, and you know, even things like erectile dysfunction, you know, that are affecting them because of sleep. People, we get worried that, oh, we have to have medical insurance cover it. Implants most time are not even covered by dental insurance, yet we still give them a treatment plan for one tooth somewhere between $4,000 to $5,000. Why not give them the treatment plan? It's a couple grand cash. I mean, stop thinking that medical has to happen. You know, I offer a payment plan. It's $500 down, credit card on file, $500 a month after that for 4 or 5 months. So it's like, it just makes sense to make it convenient for patients. Our lab costs are about $350 to $500 on the appliance. That's it. The sleep study is taken care of by the the billing for that through medical is done by another company. So it has nothing to do with us dentists. So yeah, let's get out of the mindset of like, what do we do about medical insurance? Don't let that be a deterrent for you to learn this. You can charge cash. People are doing Botox for their patients for TMJ. We're doing Invisalign and ortho, and they're paying for it. So why not charge $2,000, $2,500 for an oral appliance and not even worry about the medical insurance part?
Now, how do we find out more about Rad Healthcare?
So Rad Health, INC, Rad Health Inc., of course, .com, it's my website. You know, one of the coolest things that I've been enjoying whenever I go to Florida is, you know, your mind gets clear and I get to come up with some products. So, you know, I developed a jaw supplement as well because I saw the need for TMJ issues. for patients, popping, clicking, supplementation such as chondroitin sulfate, glucosamine, MSM, fish oil, magnesium helps with the tightness of the jaw. And we've seen patients rebuild joints. A lot of these mouthpieces that I make, I had no idea how to clean them. I would tell them, brush with your toothpaste, or don't soak it with Listerine because the lab says it can over time deteriorate the material. So I actually created a spray bottle called Rad Fresh, because I saw the need. And then you just spray your oral appliance or your sports cards if your kids play sports, and it kills bacteria, including E. coli and staph and fungus. So Rad Health has become kind of a fun thing for me, but it's serious business because we're helping athletes with their sports cards. We're helping people sleep better with Rad Z's. We're helping people with their TMJ, with Rad Jaw. So radhealthinc.com, you can go to the website. It has everything on there and my story and all that. And if you email me at my name, Dar Radfar @gmail.com, and you want some samples for the sleep supplement, I'd love to send people some samples and try it out themselves and see how they like it.
Man, such great stuff that you're up to. I wanted to ask you one last question. You're a dentist, you're an entrepreneur. If you had some advice for a young dental professional that's just getting out of school, or a young entrepreneur, what kind of advice would you give them?
I love this question because you guys got to listen up. I grew up in business, but my passion is the connection between my patients. It's a cliche, but my patients don't want to see an associate. They want to see me because I literally talk to them like I'm their neighbor or their friend. That's my personality. We cuss with my patients. We talk about family. We talk about our kids and how annoying they are and how beautiful they are and how amazing it is to be a father and what your travel trip is like and all these things that we do in life. We really connect. It's the one profession, and I challenge anyone to find another profession that you can see so many different family members and see them at least 2 to 3 times a year for an extended period of time. It's definitely a great connection. But we get stuck in our world of our office, or if we have multiple offices, it's almost like we built our own business prison. And that's why we've had so many of us, whether you're at year 10 or I'm at year 20, I think, Eric, you're at year 20 years of being a dentist, of this quote unquote burnout that you explain also in your other book. And where's the passion, right? Maybe we can take some time 1 day a week away from our practice and do things that we're passionate about, that we know about, such as for me, it was the sleep situation or creating products. I do believe you got to think outside of outside of your dental practice and create businesses, whether it's something that has nothing to do with dentistry, but e-commerce is here to stay. It's not easy to become an Amazon seller or eBay or whatnot, but having a side gig, whether it's consulting or coaching or doing some sort of, I'm really big in meditation and trying to learn techniques and, creating a more peaceful, kind of happier, manifesting life. These things, there's dentists out there that need this kind of guidance. And if you're able to learn that and coach people through that, any sort of outside thing using your profession, I'd highly recommend you try. You will fail with some products, as I have, and some will take off, and you can make a difference using your education that you've learned by taking some time off. So for some of you that work 5 days and sometimes on Saturdays, 6 days a week, God bless you. The body will fail. The mind will never have a creative space. It's a good idea to take a day or so out of the practice during the week, at least, if not more than a day, and try other things to see if you can supplement your daily routine that you do in the dental office.
Man, that is good stuff. And I personally feel like, having side gigs or, side hustles, whatever you want to call them, it helps me with my main gig. I'm more, focused when I'm in the office, and I'm not so upset if, someone cancels or because I have something else going on that I'm interested in. So, man, Dr. Dar Radfar, thank you so much for joining us, and let's be in touch, man. It was such a pleasure.
Thank you, Eric, for the opportunity, and everyone, I hope you sleep well.